About the causes, risk factors, the blood pressure regulatory mechanisms. So today we will learn the role of sympathetic nervous system in hypertension and the effects of beta blockers as antihypertensive agents. So activation of sympathetic nervous system is important in the etiology and maintenance of hypertension. So chronic sympathetic activation leads to high blood pressure. Beta blockers are pharmacological agents that prevent the actions of catecholamines. So what are catecholamines? These are epinephrine, norepinephrine and dopamine. So beta blockers prevent the actions of catecholamines on the adrenergic receptors, reducing the sympathetic activation and causing lowering of blood pressure. So let us see what are the blood pressure lowering mechanisms of beta blockers. As we can see in this figure, excessive sympathetic stimulation activates the beta-1 receptors of the heart, increases the cardiac contractility, the cardiac output increases and the blood pressure increases. So by inhibiting this pathway, the cardiac output is decreased and this contributes to blood pressure lowering. Second mechanism, excessive sympathetic stimulation stimulates the beta-1 receptors of the kidney and this increases the secretion of renin and angiotensin II formation, which is a vasoconstrictor, and it raises the peripheral vascular resistance. So by inhibiting the beta-1 receptors of the kidney, the renin secretion is reduced and the peripheral vascular resistance is decreased and this causes lowering of blood pressure. Beta receptors are also distributed in the central nervous system and stimulation of central beta adrenoreceptor increases the sympathetic outflow, increases the release of epinephrine and norepinephrine. So blocking the central beta adrenoreceptors decreases the sympathetic outflow. In the periphery, the beta receptors are expressed in the presynaptic membrane of the peripheral neurons, and stimulation of the beta receptors that are present in the presynaptic membrane facilitates the release of epinephrine and norepinephrine. So stimulation of beta receptor increases the release of epinephrine and norepinephrine, increasing the sympathetic outflow. So blocking the beta-1 receptors in the presynaptic membrane decreases the sympathetic outflow, decreases the release of epinephrine and norepinephrine, and the blood pressure decreases. Also, beta blockade causes increased cardiac secretion of natriuretic peptide, which causes increased excretion of sodium and water. This decreases the extracellular fluid volume and causing lowering of blood pressure. Lastly, beta blockers such as nebivolol is known to produce nitric oxide, which is a vasodilator, and by causing dilatation, it decreases the peripheral vascular resistance, causing lowering of blood pressure. So the beta blockers, by acting through various mechanisms, decrease the cardiac output, decrease the peripheral vascular resistance, decrease the extracellular fluid volume, causing vasodilatation, and also reduce the sympathetic outflow. So these are some of the ways through which beta blockers helps in lowering the blood pressure and they act as antihypertensive agents. So how do we classify beta blockers that are available as antihypertensive agents? Beta blockers can be divided into three generations. The first generation is the non-selective beta blockers that block both beta-1 and beta-2 receptors, and the drugs are propranolol and fingalol. The second generation beta blocker is the cardio-selective beta blockers that selectively antagonize the beta-1 receptors of the heart, the beta-1 receptors of the kidney, and the drugs are atenolol, metoprolol, esmolol. Then we have the third generation beta blockers. This is the newer generation and the drugs are nebivolol, celiprolol. So these drugs, in addition to antagonizing the beta-1 receptors, they also have vasodilatory property. They cause vasodilatation of the blood vessels and this helps in lowering the blood pressure. When it comes to uses of beta blockers, the cardio-selective beta blockers and the newer generation beta blockers are preferred as antihypertensive agents. Next, we move on to the use of beta blockers as antihypertensive agents. Earlier, beta blockers used to be the first step in the management of hypertension, but currently, beta blockers are no longer used as an initial treatment in an individual who has only high blood pressure. So as per the recommendations of American Heart Association, a patient who is at high risk for coronary artery disease such as diabetes or chronic renal disease, the first choice antihypertensive should exclude beta blockers. So beta blockers are not used as initial treatment, they are not used as monotherapy. However, beta blockers can be used as combination therapy. For example, a beta blocker can be combined with a diuretic agent because diuretic exhibits the property of synergism. So, a diuretic potentiates the action of a second antihypertensive agent, increasing the clinical effectiveness of the regimen and decreasing the adverse effects, improving the safety profile of the regimen. Beta blocker can also be combined with the vasodilator, as we have learned that vasodilators are known to induce tachycardia and increase the plasma renin activity because of stimulation of sympathetic reflexes. So beta blockers can counteract tachycardia and normalize the plasma renin levels. So they help in decreasing the side effects and improve the efficacy of the regimen. So a beta blocker can be combined with a diuretic and a vasodilator in hypertension that is resistant to other antihypertensive regimens. So in this way, beta blockers can be used as combination therapy. They are no longer used as monotherapy and not used as initial antihypertensive drugs. A beta blocker known as esmolol has ultra short duration of action. Because of ultra short duration of action, it is preferred in urgent settings. It is given intravenously where beta blockade of short duration of action is required, for example, during surgeries. Because the duration of action is very short, the effects can be immediately withdrawn if adverse effects like bradycardia, hypotension and heart failure appears. Besides hypertension, beta blockers can be used in other cardiovascular diseases. They can be used to treat supraventricular arrhythmias, for example, atrial fibrillation and atrial flutter. Beta blockers can also be used during post-myocardial infarction as they can prevent the occurrence of arrhythmias during the post-myocardial infarction period. Also, they can be used for the treatment of angina pectoris. So, beta blockers in addition to treating hypertension can be used in other cardiovascular conditions. Metoprolol offers mortality benefit. It improves the survival rate in patients and it has cardioprotective property and therefore it is preferred in the treatment of congestive heart failure. Atenolol has a longer duration of action and can be given once daily, therefore it is preferred as an antihypertensive agent. So these are the uses of beta blockers in hypertension and other cardiovascular conditions. So which are the clinical conditions in which you would avoid using beta blockers as antihypertensive agents? Beta blockers are contraindicated in a diabetic patient receiving insulin and many of the oral hypoglycemic agents. Hypoglycemia is a common side effect of insulin therapy and many of the oral hypoglycemic agents such as sulfonylurea. So the autonomic response to hypoglycemia causes symptoms such as hunger, palpitations, sweating, tremor, and this wants the patient to eat sugar and this helps to normalize the blood glucose level so the hypoglycemic episode does not go unnoticed into hypoglycemic coma. So in response to hypoglycemia, there is beta-2 mediated stimulation of glycogenolysis and gluconeogenesis. Glycogenolysis means breakdown of glycogen to glucose and gluconeogenesis means synthesis of glucose from amino acids. So there is increased release of glucose into the bloodstream. This helps to normalize the blood glucose level during hypoglycemia and prevents hypoglycemic coma. So the sympathetic responses are protective homeostatic mechanisms of our body and in presence of a beta blocker, the sympathetic symptoms are blocked and this causes the hypoglycemic episode to get unnoticed and the patient may go into hypoglycemic coma and also there is delayed recovery of hypoglycemia because the sympathetic reflexes are blocked, and therefore these drugs are contraindicated in a diabetic patient receiving insulin and oral hypoglycemic agents. Beta blockers are also known to cause adverse effects on the lipid profile. The triglyceride levels increase and the HDL levels decrease. Therefore, beta blockers should be avoided in a patient with dyslipidemia or in a diabetic patient who is more prone to develop dyslipidemia. Beta blockers are also contraindicated in acute bronchial asthma, the reason being the beta-2 receptors are expressed in the bronchial smooth muscle, and stimulation of beta-2 receptor causes bronchodilation, and this helps in relieving the symptoms of acute bronchial asthma. So, beta-2 agonists are used in the treatment of bronchial asthma. Beta blockers can cause worsening of symptoms of asthma because they block the beta-2 receptors, they block the bronchodilation. This causes increased tone in the bronchial smooth muscles, and this can aggravate symptoms of bronchial asthma. So they are contraindicated in bronchial asthma and chronic obstructive pulmonary diseases. Beta blockers are also contraindicated in peripheral vascular disease and Raynaud's disease. As we can see here, the smooth muscles of the blood vessels express beta-2 receptors, which causes vasodilation and increased blood flow. Alpha-1 receptors are also expressed, which cause vasoconstriction. So by blocking the beta-2 receptors, there is loss of vasodilatory response, and the unopposed action of alpha-1 receptors causes vasoconstriction, increases the tone, causes narrowing of the blood vessels, and this decreases the blood flow to the peripheral regions, thus aggravating the ischemic pain. So ischemic pain is aggravated in presence of a beta blocker because of blockade of beta-2 receptors and unopposed action of alpha-1 receptors, which causes narrowing of the blood vessels and decreases the blood flow to the periphery. So we can see in all of the clinical situations that have been described, it is the beta-2 blockade action that causes undesirable effects. Therefore, non-selective beta blockers such as propranolol are avoided, and cardio-selective beta blockers that have selective action on the beta-1 receptors of the heart and minimal action on the beta-2 receptors are preferred drugs in the management of hypertension. So cardio-selective beta blockers may be used with caution in a patient with diabetes, bronchial asthma or peripheral artery disease. So these are some of the precautions and contraindications related to the use of beta blockers as antihypertensive agents. A precaution that needs to be kept in mind when prescribing beta blockers is that beta blockers should not be abruptly discontinued. This is because with chronic therapy with beta blockers, there is increased upregulation of beta adrenergic receptors. So there are more number of receptors that are available in the nerve terminal, and these receptors are hyper-responsive. They are super sensitive to even small releases of catecholamines. So even small release of catecholamine can cause an exaggerated response. So if beta blockers are suddenly withdrawn, there is increased activity of these receptors, there is increased response of these receptors to the catecholamines, and this can cause sudden rise in blood pressure which can be life-threatening. So beta blockers should not be withdrawn suddenly. The dosage should be tapered before complete discontinuation of the drug. Otherwise, this can lead to rebound hypertension, sudden increase in hypertension and anginal attacks, and this can be life-threatening to the patient. So in this session, we have learned about the various beta blockers that are used as antihypertensive agents, the cardiovascular uses of beta blockers, the side effects, precautions, contraindications.